My name is Marsha Greene Jones. I'm the Deputy Director of Human Resources for the City of Philadelphia. I'm also the Board Chair for the Greater Philadelphia Business Coalition on Health. So the City of Philadelphia has approximately 28,000 to 30 employees. Our employees are required to reside in Philadelphia County. So as a consequence of that, every single community is actually represented within the City of Philadelphia. Our employees are citizens too. The City of Philadelphia is a member of the Greater Philadelphia Business Coalition on Health, I think for a number of reasons. The first reason is while we're using taxpayer dollars, one of the things I think we looked at is what organization could help expose us to other companies that actually operate in Philadelphia and also the Greater Philadelphia area. We wanted to understand what was going on from the healthcare organizations perspective, what companies were doing, how they were utilizing their resources. So it was a great opportunity for us to share ideas, to meet others who were like-minded, and to actually grow and expand, because one of the best things I think about the coalition is the educational components of it, and that we have people who are in the field bringing information that is new, fresh, on a regular basis. So that's one of the things I think that really attracted me to the organization initially. This membership, I have met so many wonderful people who really have the same ideas that we have in terms of making healthcare more accessible to others, focusing on health equity, focusing on the social determinants of health. And as we talk to other people, we grow. So when I'm talking to, say, Jim Rhodes from Camden, he's telling me what his struggles are. When I talk to someone from Wawa, they're telling me what their challenges are. And I think together we share our ideas and what makes sense and what's best. And also we talk about vendors that we're using, because I have to say that I selected a vendor based upon some feedback that I received from another member. So kind of it works in terms of us understanding what's best practice. I participate in quite a lot of initiatives that the Greater Philadelphia actually has. So a more recent one was, and I think this was probably one of the best ones I participated in the Health Next project with the CDC. So one of the things with the City of Philadelphia, to get sponsorship and approval, there's a long approval process. But I thought it was worth it for us to go through this process, the Culture of Health project, to really help us understand what we were doing, how we were doing it, and our areas of opportunity. And so this project, the Health Next project, helped us to really evaluate ourselves as a provider of healthcare to our citizens and our employees who work in the City of Philadelphia. So out of that project, I was able to get additional budget approval for a data warehouse. I was able to add additional staffing, and I've gotten the total support of our CFO and the head of HR for the City of Philadelphia. The value that these initiatives bring is it opens up opportunities in terms of what is going on in the space for healthcare benefits. So say, for instance, the Culture of Health project. Something that we always wanted to do more closely was to look at our data. I did not have the budget approval to do that. But this project actually gave us the impetus to write a proposal and to actually get budget approval. So now what it will do for us is help us to look at our data more closely, to identify where our gaps in care are, and to laser focus on projects, whether it's a narrow network or whether it's changing contributions, that will really help escalate and improve presenteeism and the quality of life for our employees. Being a member, as far as healthcare value, it really helps us in understanding what's important to employees. Focus groups, communicating effectively with your employees. Employees don't know what's important to them until they see it or they don't have it. So we want to be on the positive side of it and ensure that our employees understand what we're presenting to them and what the possibilities are in terms of their general health. If we have healthy employees, they'll be higher, be more engaged as a workforce. And I think that they'll feel that us, the City of Philadelphia, really cares about them, because that's one of the things, throughout the pandemic, we hear employees kind of not feel like their employers cared about them. And so we want to demonstrate to our employees, whether it's an educational lunch and learn, whether it's a project that we're doing with regard to opening up the doors, adding additional benefits. We want them to know that this is because we care about them. My membership experience has been phenomenal. What it means to me is my ability to influence outcomes with providers, with regard to our employees. Because when I can influence the outcomes, because every meeting that I go to or educational seminar, you're meeting someone else who has a story or who has information that you can glean. So one of the things I've been thinking about is introducing a new benefit. And I've taken the steps to start that initial investigation, but I've talked to others and I can glean from others who've implemented this program. How did you learn? How did you grow? What were the things that you thought went wrong? What are the things that worked best? Was it what you thought it could be? So we have that advantage of talking to others who have actually done a similar type program. And that's always helpful because, a provider can tell you anything. But the rubber hits the road when I'm talking to another colleague who can confirm or not confirm that this was a positive experience. And so I recently contacted Wawa about something. I had a meeting with them. We were working on a project and a provider said, oh, well, Wawa is one of the customers. So I thought to myself, I know Wawa. I'm going to give them a call. And so as a consequence of that, I was able to bring to the provider some of the things that were missing as far as their proposal was concerned that I gleaned from that conversation with Wawa. So, for that, I would have not met Wawa in this space before because we kind of operate in a vacuum. And this is a local organization, which I think is different than when you're going to national meetings because you're meeting people from all over the country. The thing about a local organization is it has local people with local ideas, local issues, because we all share that same space. So therefore, we're all probably using some of the same providers. And so therefore, we can actually validate and confirm, or we make decisions that we don't want to move forward. So that's kind of one of the best things that's come out of this. I have to say that being a part of a local healthcare organization, the Greater Philadelphia Business Coalition on Health, has been phenomenal. It has exposed me to other employers that I would not have had that opportunity to interact with on a national basis. We shared some of the same issues, shared some of the same providers. I recently had a situation where we were looking at a provider and I knew that Wawa actually had selected this provider. So I called up Wawa and had a discussion with them about what their thoughts were, the pros and cons. And as a consequence of that, I was able to make a more informed decision. And that's one of the benefits of it. People that you trust, that that are using the same metrics. And they're looking at our populations, although we're different businesses, our employees are virtually all the same because we're coming from this greater Philadelphia area. So that's one of the very wonderful aspects of this, whether it's contacting Wawa, Independence Blue Cross, Armark. I could name all the companies that we interact with, and the consultants also are extremely helpful, whether it's Nova Nordis, whether it's some of the other consulting groups that we work with. Everyone's willing to share information. And because at the end of the day, the health of all our citizens is important to all of us. I came to the city of Philadelphia at the end of my career. I lived in Europe, headed up HR, done a lot of various things, head of HR, for various corporations. But this was a role that really affected the lives of people. Healthcare is it's the second largest cost to any organization. And when you can affect the well-being and the lives of people, it makes such a difference when you can see that people are thankful for you providing information about well-being, about diabetes, about an educational seminar that helps them navigate through their healthcare system. That's invaluable. And that makes employees feel that this is worth it for me, that this employer cares about me and the value that they actually bring. So I think for me, it's about making a difference and I'm very, very passionate about this, especially the health equity issue. As a person of color, there aren't many people of color in this space, and it's my responsibility. I take it personally that I'm going to do everything in my power to ensure that all employees are treated equitably no matter where they are, who work for the City of Philadelphia.